Hello and welcome to the health program on Trust TV. I am Aisha Salihu. On the last episode of Healthy Living, we explored the role of HPV vaccination and the prospects of the vaccine in eliminating cervical cancer in young girls and women folk. On to a broader discussion on the subject. This week, we'll elaborate on the strains of the human papillomavirus and its resultant effects on causing cancers in women and men. We'll further explore sexual health as sexually transmitted infections like HIV and HPV have become common. As part of the messages in this January's commemoration of the Cervical Cancer Awareness Campaign with the theme, Be Informed, Get Screened, Get Vaccinated, the WHO Africa Regional Director, Dr. Mashidiso Moeti, says there is a need to be aware that women living with HIV have increased susceptibility to HPV infection and so an increased risk of cervical cancer. While this is a particular challenge in the African region with high levels of HIV infection, this is also an opportunity to use HIV screening and treatment services as another avenue to raise awareness of cervical cancer and offer screening and vaccination to women attending HIV services. However, HIV services are not the only programs into which cervical cancer screening and treatment services can be integrated. We have joining us Dr. Ishaq Lawal, who is a gynecologist with interest in gynecologic oncology, practicing at the Federal Medical Center, Birnin Kebbi. He has done advocacy activities on HIV and cancer prevention. You're welcome to the program, Doctor.
It's a pleasure having you.
Okay. Now, we know that January is an awareness creation month for cervical cancer. According to research, cervical cancer could be triggered by sexually transmitted diseases from certain strains of the human papillomavirus. I'd like to hear from you as an expert in your right, of course, through advocacy activities on HIV and cervical cancer prevention, starting off from the basics of cervical cancer in women.
Yeah, cervical cancer, as the name implies, is the cancer of the cervix. And what is the cervix? Cervix is the lower part or the door entrance of the womb. So, and cancer on its own is abnormal proliferation of a normal cell, to the extent that the cell will now acquire what we call immortality and ability to move to another part of the body to cause trouble. So, in brief, cervical cancer is a cancer of the mouth of the womb and is the second commonest cancer affecting women in Nigeria. The commonest cancer is breast cancer. And the thing about cervical cancer is the fact that, unlike most cancers, it has a well-understood pathogenesis. What do I mean by pathogenesis? I mean the understanding of the processes that leads to the cancer. For most other cancers, we only know that there are factors, there are triggers that can cause them, which are not something that we can really control. But for cervical cancer, as you rightly mentioned, we know that HPV infection is a trigger for having cervical cancer. But let me quickly also add that HPV infection is sexually transmitted, but cervical cancer is not sexually transmitted. We need to emphasize and really emphasize on that fact that HPV infection is sexually transmitted, no doubt about that, but cervical cancer is not sexually transmitted. And let me further explain. Because having HPV infection does not automatically translate to having cervical cancer. HPV is a very ubiquitous virus. What do I mean? It is common. And there are various types of HPV viruses. affecting both human and animal. There are some variants that don't have any impact on human. But it suffices to say that we can group these HPV viruses into two groups. Those we call high-risk HPV virus, which the commonest of them is 16 and 18. There are other types, other variants, 35, 45, 52. All those figures to just identify those viruses. And there are those we call low-risk virus. And these are viruses, HPV virus, that when they infect the human, they will not lead to cancer, but they can cause things that we call WAF. So the commonest of those will be 6 and 11. So when somebody have HPV infection, and don't get me wrong, most women will have HPV infection in their course of reproductive career. But what we have understood is that we need that HPV infection, it triggers a process which we call integration into the genome of into the body cells of the cervix, and then begin to take over the control. So it's not in every woman that HPV infection occurs that is going to have that integration. 90%, 99% of women will clear it without even knowing that they have it. And that is the beauty of the the vaccine. The vaccine will now prevent the woman, the girl from having it, or the woman from having it, from the infection, and will also prevent the integration if even the infection occurs. So, to summarize again, is that yes, we are aware that HPV infection is necessary trigger for cervical cancer. HPV infection is sexually transmitted, but cervical cancer is not sexually transmitted because it takes a variable period between 10 to 15 to even 20 years between HPV infection to actual development of cervical cancer. And that's why we're saying that giving the vaccine at adolescent age, because the way these HPV triggers for the cervical cancer is that usually you acquire the HPV at adolescent when you during your sexual active, at the time you're having your sexual debut. So you acquire that HPV infection at that time. Unlike most other vaccines and most other infections, that you acquire the infection and the impact of the infection is seen immediate. But for HPV infection, the impact of the infection is only seen 10, 15, 20 years down the line. So and this is important for our viewers to also know, because one of the things when the HPV vaccine was introduced was that a lot of people were asking, why are we targeting the adolescent? And that's probably created a platform for the misconception. The target of the adolescent is based on the time of the infection. But the uniqueness of the HPV infection is the fact that you acquire the infection at a particular point in time, but the effect is seen at a different point in time. Hence, there's that confusion to the lay people to say, look, cancer is not common in adolescents, cervical cancer is not common in adolescents, yet we are vaccinating the adolescents, and the adults that have the cancer, they are not the one we are targeting for vaccination. I hope the listeners, the viewers at home, will now understand why we are targeting the adolescent for the vaccination. So in summary, that's what it is regarding HPV infection and the cause of cervical cancer.
Thank you so much for that elaborate response and huge clarification. You have stated that the variants 16 and 18 of the HPV are the most common and popular, and it takes up to 10 to 15 years before it develops to cancer. Hence, the need for vaccination to be administered to adolescent girls aged 9 to 14 before their sexual debut. But we know it is not enough that we're talking about women alone, especially as the strains of the HPV may also be responsible for some cancers in men, as our focus is on HPV. I'd like for you to put us in the right direction. How does this work? And with the male population.
Yeah, cervical, the thing about cancer is that every part of the body can have cancer. So we use the part of the body that the cancer is affecting to describe the cancer. So cervical cancer affecting the cervix, breast cancer affecting the breast, colon cancer affecting the colon, that is the intestine, prostate cancer affecting the prostate, penile cancer affecting the penis, and testicular cancer affecting the testicle, bone cancer affecting the bone, blood cancer affecting the blood. I mean, it sounds somehow, but even the blood cells can have cancer. So any living cell is at risk of cancer. So I made this to say that because men don't have cervix, they cannot have cervical cancer. Because women don't have prostate, women cannot have prostate cancer. But both men and women have breast. Forget the fact that the breasts of the men are not well established. But if you look at the chest of men, you see some protrusion there, which is the position of the breast, and you see all the component of breast as it entails in the female, also in the male. It's just that while that of the male is rudimentary, is small, that of the female is well established and well developed. So both men and women have breast cancer. And up to a significant number of men to have breast cancer. So that is to just say that cervical cancer does not affect men because they don't have the cervix. However, the HPV virus that is the cause of the cervical cancer can also cause penile warts in men, can also lead to penile cancer, that's cancer of the penis, can also lead to throat cancer, oropharyngeal cancer in both men and women, can lead to anal cancer, that's cancer of the place where we pass through the anus, anal cancer in both men and women. So the HPV on its own causes more than cervical cancer. It can affect, HPV virus can affect both men and women in the areas that I have mentioned. But why we are particular about cervical cancer amongst all these other conditions that the HPV virus can cause, i.e. oropharyngeal cancer, cancer of the throat, mouth and throat, cancer of the penis, cancer of the cervix, cancer of the vulva, cancer of the anus, is the fact that cervical cancer is the commonest. And there is this thing in public health where you talk about cost efficiency, judicious use of public funds. There's limited resources for unlimited development in any intervention you want to do. So you want to look at the most efficient use of public fund. Because oropharyngeal cancer or penile cancer or anal cancer is not that very common, it's in existence, and people should know about it and take every necessary precaution, no doubt about that, at individual level. But for cervical cancer, the prevalence is so much that I don't know, I'm not sure, I don't really have the idea of the time, but if it takes us these 30 minutes to have this discussion, in that 30 minutes, 30 people will have developed cervical cancer, and 15 will probably have died of cervical cancer in this space that we're just talking. So, and then based on the development, understanding of science, and understanding of pathophysiology of the cervix, of cervical cancer, developed countries have been able to reduce cervical cancer burden to the barest minimum and have made cervical cancer a non-significant disease for them. One, they are able to efficiently prevent it, and where they are not, where in situations that it then develop, despite, because even after you have done everything necessary, sometimes we have what we call incidental cancers. So even when you now have done everything necessary and you still have the cervical cancer, there is adequate treatment that you can be cured of the cancer. Therefore, cervical cancer particularly is not a death sentence in developed countries, unlike in developing countries like Nigeria, where cervical cancer still remains a death sentence. And that is why the Director General of WHO in 2018, I believe, called for global collaboration to eliminate cervical cancer. And Nigeria, with the support of Her Excellency Dr. Zainab Shekafi, will make advocacy in that 2018 to the United Nations, where that global declaration was accepted. And within 2 years, a global framework was developed called Global Strategy to Accelerate Elimination of Cervical Cancer.
Thank you so much. But doctor, I'd like for us to streamline our conversation towards sexual health, because you have stated a number of cancers that could come from HPV infection for males and also for females. You stated a point from the WHO earlier. In that regard, still talking about the commemoration of January being Cervical Cancer Awareness Month, the WHO Africa Regional Director, Dr. Mashidiso Moeti, also stated the relevance and importance of enough awareness at bridging the care gap for HIV infection, as it could cause increased susceptibility to HPV infection, leading to cervical cancer. I'd like for you to, educate us further on sexual health, just so people are not at the risk of contracting sexually transmitted infections like HPV, which may later develop to cervical cancer, anal cancer, penile cancer, cancer of the throat, among others, and HIV infection, which may later develop into AIDS.
Yeah, thank you very much. The thing about HPV infection is that HPV infection is not the typical sexually transmitted infections that we have of HIV. For HIV sexually transmitted infection, we talk about ABC, abstinence, and then use of condom, behavioral changes, and then use of condom. But for HPV, apart from the abstinence, you can't prevent yourself from having the HPV, because condoms cannot prevent having HPV. Just HPV is so ubiquitous that just a handshake can transmit HPV. Like a lady or a man that has HPV on his hand, who can shake hand, and eventually when you go to wash up, you can then self-infect yourself from your hand to your private part, self-infect yourself with HPV. So having HPV infection has nothing really to do with that sexual behavioral habit of HIV. HIV is a typical sexually transmitted disease that can be prevented both by abstinence and behavioral changes, and in addition, use of condom. Use of condom cannot prevent HPV infection. But the relationship between HIV and HPV goes beyond just being both of them just being sexually transmitted diseases. I mentioned earlier that HPV infection is very common, that 99% of women will have HPV infection in their career, in their lifetime. But that is not same of HIV. Only few people will have HIV infection based on their sexual behavioral habits. But only majority of these women will clear it that they will not have the consequence of HPV infection. Now, we are not very clear on those factors, who is going to clear it, who will not clear it. But what we are sure of is the immune status of the patient, of the woman, is a factor in determining who is going to clear. So if somebody have HIV and have HPV infection, because the person already have HIV, then the ability to clear the HPV is reduced. Hence, HPV infection in HIV positive patients is more aggressive. I said earlier that when you have HPV infection, it takes 10, 15 to 20 years before to develop cervical cancer. That is for a healthy person without reduced immunity. But in HIV patient, it is saying that when you have HPV infection, then the rate of progress is faster, that the progression from HPV infection to cervical cancer takes less than the traditional 15 to 20 years that I quoted earlier, maybe 5 to 10 years for HIV infection. And not only that, when the cervical cancer is seen in HIV positive patients, it is more aggressive, such that cervical cancer is now one of what we call HIV and AIDS determining infection, AIDS determining conditions.
Just before we let you go, I'd like for you to elaborate on the safe practices to prevent HPV and the ones for HIV, just very quickly.
Yeah, of course, the same practices are what we always call the ABC when it comes to sexual lifestyle. Abstinence. Abstinence is the gold standard, but of course we know that we can always, there will always be need to have sexual activities legally in the marriage system. And there are then behavioral, being faithful to one partner. And then when you're going to have sex, use condom if you will have sex outside of being faithful, which we are not encouraging. But if that's going to happen, then you use condom. But we need to emphasize that even when you use condom might not prevent HPV. So in terms of HPV, the behavioral change or the lifestyle that you need to do is to ensure that you vaccinate your girls at that age of 9 to 14. Because that vaccination, of course, it's not only the 9 to 14 is the one that federal government or WHO is promoting and federal government is supporting, so it's going to be free. But if you have your resources, if you have your money, you can vaccinate girls even after the age of 14. But if you're vaccinating them after the age of 14, instead of the single dose that we are using, it is advised that you use 2 doses. So ensure that the girls are vaccinated. And in terms of cervical cancer, we need to also encourage women after the age of 25 to ensure that they go for screening, because vaccination for girls, screening for adults. And overall, when anything is detected, we need to have this positive attitude to say that what we have detected is not cancer, it's something that can lead to cancer, and then make ourselves available for treatment. For screening without treatment is waste of time, it's effort and futility. It is only the treatment of screen detected condition that will disrupt the progression of HPV infection to the cervical cancer.
Thank you so much, Dr. Ishaq Lawal, a gynecologist with interest in gynecologic oncology, practicing at the Federal Medical Center, Birnin, Kebbi. This is the much we can take at the moment. We do hope to reconnect with you in subsequent episodes of the program to have your thoughts.
Thank you.
That concludes this week's episode of the program, Healthy Living on Trust TV. For comments, contributions, and suggestions, do well to follow and subscribe to all Trust TV social media handles. Download the Trust TV app on iOS and Android devices across their respective stores and get live updates on the YouTube live stream and the website. Join us next time as we continue to explore subjects crucial to your health and well-being. I am Aisha Salihu. Thanks for your time.